The following segment is sponsored by Doctor Lampee.
Welcome back to Afternoon Live. What if we told you you could have a brand new smile in just 24 hours? Well, now you can, and here to tell us how, we welcome to the show, Dr. Heath Lampee is back with us. Dr. Heath, good to see you.
Hey guys, I'm here. I beat the snow.
I know, so did I. This is so great that we can have this conversation today. I was wondering if we would, but it's a really good one to have. Can you talk about, first of all, the timeliness as far as having a healthy mouth?
So many of my patients haven't been to the dentist in 5, 10, 20 years, and their mouth has a lot of infection in it. While a lot of these infections may not hurt, they are kind of silent infections. They're gum disease. They're infections and abscesses that can sometimes drain. They can leak into the sinus. What all this does over time is overtax your immune system, so the rest of you isn't as healthy. Patients wonder why they can't control their diabetes, why their autoimmune disorders are getting worse, why they have to be on even more different blood pressure medications. And for some of these patients, often it is in the mouth, and we need to get the mouth healthy to keep the rest of the body healthy, especially with coronavirus around.
Exactly, and you talk about patients waiting so long. I can only imagine why, but why is it that people come to you and say, you know, it's been 10 years?
The number one reason is fear. They think of the dentist and they just have trepidations. They have had such bad experiences in the past that they don't want to go. And even though they know something may be really wrong in there, oftentimes they just don't want to know about it. If nobody talks about it, then it doesn't exist. But eventually they know they need to come in, and that's why they come and see us.
And you know, you've done some great things with these patients. I first off want to show this patient of yours, Sue, because I think this is incredible, but even more so, you have to share her story.
So Sue thought about coming to the dentist for a lot of years, but she had had those bad experiences in the past. And she found us through some of our different advertisements on TV. That's how we get the word out. And she drove from about 2 hours away to come see us. And she knew when she set foot in the office that this was a different type of office, that we do all of this from our heart. We do this with passion, and we see as few people as possible in a day so that we can spend as much time with each patient as possible to see what's going on, where do the problems arise, and how can we fix this. So she came in from two hours away. The whole mouth was infected. It had been probably 10 years. We had to take the teeth out. That's what we had to do. They were beyond repair. So in one day, we were able, with sedation, to take the teeth out, put implants in, and get her a brand new, healthy, beautiful smile.
I mean, you see those pictures of the before and after, and she is just lit up in the after. I mean, her teeth are beautiful, but even in her eyes, you could see it.
It's a new glow. It's a new zest for life. It's a new energy. Where I have so many patients where they've lost hope. They feel old. And all of a sudden, they finally come in and say, can you help me? And when we do, they get that new youthfulness, that new zest that they have lost.
You talk about Sue there having the implants. What other services, what else do you do?
So a lot of what we do is full mouth implant services, and where we put implants in and we do our screw-in permanent teeth. Our second option for those that we can save their teeth is our full mouth crowns and veneers. That's for broken teeth, chipped teeth, old cavities, old fillings, and we can make them beautiful in a day. And then for patients with really bad gum disease, we can actually get a laser in there, a LANAP laser, to kill the bacteria that are actually leaking into the bloodstream and get the mouth healthy again and actually help reverse gum disease. And so those are our 3 treatments.
And truly 24 hours, as you're talking about, it can just take that one day. What does that look like?
So we generally see, when we're doing large complex cases, we like to see our patients about 7 a.m. We get them very comfortably sedated, because the best dental appointment is the one you don't remember. We get all the procedures done, usually somewhere in between 11 a.m. and 1 p.m. Sometimes the patient has to come back the following morning to get teeth and stuff like that. But just about 24 hours with that sedation, we can do all of these procedures comfortably and safely.
Which is incredible, and I think takes away a lot of the anxiety for people as well.
Yeah, and that's what's so amazing about my job is I focus on fewer people so that we can take that time. And because we have to unravel a lot of those bad experiences, and kind of start fresh. We have to start with a blank canvas so that we can paint a beautiful new picture going forward.
And can you tell how that changes the patient's not only smile, but attitude to life?
My favorite thing is to see my patients probably 4 to 6 months when we're done with treatment. And sometimes when they walk in the office door, I have to do a double take because I'm like, is that Sue? Because it's totally different. They walk in beaming. They've got that new smile. They've got that new glow. A lot of times they've lost weight. They just look so good. And it's one of those things where, you just want to hug them because it's like you were part of this.
Really neat. Thank you so much, Dr. Lampee. Good talking to you.
All right, thank you so much.
Yes, absolutely. We'll have more information about Dr. Lampee and how you can get your new smile on our website at KATU.com. Do not go away. Afternoon Live, we'll be right back.